Hi, there are signs that you shouldn't ignore during pregnancy. If you're pregnant or you have someone who is pregnant, do well to share this video with them. Every pregnant woman, as well as their families, need to recognize these signs and act appropriately. Early detection of these signs helps to prevent complications that accompanied some pregnancies. Remember, our aim is to have a healthy mother and baby. Now, here are the signs that you should not ignore during pregnancy. One is fever. If your body temperature is up to 38 degrees and above, then you need medical treatment, because it could be as a result of infection either from bacteria, fungi, virus, and others. In our environment, it could be malaria caused by Plasmodium falciparum. So in this case, you need treatment. It could also be bacteria or virus, and this may cause upper respiratory infections or urinary tract infections. So in this case, you need medical care. Now, fever of 38 degrees and above isn't good during pregnancy, especially at the early stage of pregnancy, because it can affect the fetus or might even cause the uterus to expel the fetus, that is the baby in the womb. Also, malaria can as well invade the placenta tissue, which may not be good during pregnancy. So in this case, go to hospital. Number 2 sign that you should not ignore during pregnancy is blurry vision and convulsion. If you see flashes of light or bright spots, or you can't see at all for a short time, that is not a good sign in pregnancy. It could be as a result of hypertension in pregnancy. And if the hypertension is accompanied with protein in your urine, that is preeclampsia. And if the pregnant woman is as well convulsing, that is eclampsia. The pregnant woman, in this case, should seek for medical attention immediately. Another sign is severe headache. Headache that comes and goes or is consistent. If you keep experiencing severe headache even after taking medications and fluids, then you need medical attention. 4. Severe abdominal pain. Normally in pregnancy, there is usually abdominal cramp due to the distension of the uterus, to accompany the baby. But if this abdominal pain becomes severe, then you need medical attention. If it's a sharp pain and doesn't go away, rather become worse, then it could be as a result of ectopic pregnancy, placenta abruptio, miscarriage, or even urinary tract infection. So go to hospital. Another sign is bleeding from the birth canal. If you're experiencing such, it could be that the baby did not implant in the uterine wall. It could also be that the placenta has detached itself from its position, that is placenta abruptio, or the placenta is lying low, that is placenta previa. So in this case, you have to call or go to the hospital. Also, if you experience fluid, leakage of fluid, that is leakage of the amniotic fluid that covers your baby, then you also need to go to the hospital. 6. Severe nausea and vomiting, that is severe morning sickness. Normally in early pregnancy, especially the first trimester, most women do experience morning sickness, that is nausea and vomiting, and some might even extend to evening or night. Okay, so that is normal. But when it becomes severe, making you to feel very sick and always throwing up, no matter what you eat or drink, nothing stays in your stomach. For some women, this morning sickness, severe morning sickness, might continue even after first trimester, and that is called hyperemesis gravidarum. Okay, and some might even have dry lips or dry mouth, might get confused and have headache. So you need to go to the hospital, because it's not good at all. 7. Severe swelling of the face, the hands, the body, the legs. This is not the usual mild swelling of the legs that some women do experience, especially towards the end of their pregnancy. The one I'm talking about here is swelling of the face. You're experiencing that your face is swollen, that you might even find it difficult to open your eyes, and your hands are swollen, your feet are swollen, is medical emergency. So you need to consult your gynecologist or your midwife. I always encourage people to avoid over-the-counter drugs. So when you have this kind of challenge, go to hospital for expert management. Another sign to talk about here that every pregnant woman shouldn't ignore is having severe chest pain and heart beating that is very fast. If you're having tightness of the chest, or you feel pressure at the center of your chest, or your heart is beating very fast, then you need medical attention. When talking and breathing becomes extremely difficult for you during pregnancy, then you need medical care. 9. Severe dizziness and feeling fainting. Normally, pregnant women do feel dizzy during pregnancy due to hormonal changes, but when it becomes severe, then you need medical attention, because it could be as a result of low BP, anemia, or even dehydration. So if your brain is not getting enough blood, you might feel dizzy or fainting. Okay, so if it's severe, don't forget to seek medical attention. Now, the last sign to talk about here is reduced baby's movement, or the movement stopped. Normally, babies in the womb start to move as early as 6 weeks of pregnancy, but a pregnant woman begins to feel the movement around 20 weeks of pregnancy and some 22 weeks of pregnancy. Each baby has its own pattern of movement, so you as a mother should try to understand how your baby moves in the womb. If you feel that your baby's movement has stopped or has reduced, then you need to seek for medical attention. Let the midwives and the doctors check the fetal heart rate and know whether your baby in the womb is okay. Thank you so much for watching this video. If you have found it helpful and you would like to watch similar videos from this page and channel, don't forget to subscribe and follow my Facebook page. Share this video with your family and friends and give it a thumbs up. See you in my next video. Bye.